Hey, welcome. If you're in the healthcare field or even just starting out, you know that you've absolutely got to know your stuff when it comes to IV lines. So today, we're going to break it all down in this super clear clinical guide. Let's get right into it. So here's our game plan. We'll start with the basics, then get into how to pick the right tool for the job. From there, we'll walk through the procedure, talk about how to spot trouble, and wrap up with ongoing care. It's really the whole journey, from tip to drip. All right, first things first, we have to build a really solid foundation. So what exactly is an IV line when you get right down to it? Well, at its core, you can think of an IV line as a direct highway into the body's bloodstream. It's this tiny sterile tube that goes right into a vein. And what's so critical about this is that it lets us bypass the entire digestive system, which means we can get things to work fast. This is absolutely key in emergencies and for treatments that need to work right now. And you can see just how versatile that highway really is. I mean, we use it for just about everything, from giving fluids to someone who's dehydrated to administering powerful antibiotics or chemotherapy. It's also our go-to for blood transfusions and even for providing complete nutrition. That's total parenteral nutrition, or TPN, when a patient can't eat. It's honestly one of the most fundamental tools in all of modern medicine. Okay, so we know what an IV is and why it's so important, but how do we choose the right line for a particular situation? Because this is definitely not a one-size-fits-all kind of deal. Generally speaking, there are two main categories. You've got your peripheral line, which you see on the left. Think of this as your everyday workhorse. It goes into a smaller vein, usually in the hand or the arm, and it's perfect for short-term stuff. Then on the right, you have the central line, or CVC. This one's for the long haul. It's placed in a big central vein, like the jugular, for therapies that last for weeks or even months, or for giving medications that are just too tough on smaller veins. Okay, now this slide right here, this is a lifesaver, both for your exams and for real-world practice. It's the gauge guide. Take a look at the colors and what they're used for. Let's say a major trauma patient comes in and you need to push a lot of fluids, fast. You're going to reach for that big 14-gauge orange cannula. But for just some routine fluids, that 20-gauge pink is your go-to. This color-coding system is an amazing mental shortcut when things get hectic. And look, if you only remember one thing about IV gauges, please let it be this. I know it feels a little backwards, but it is the golden rule. The smaller the gauge number, the wider the catheter. It's a bigger pipe, which means you get a much faster flow. So yeah, a 14-gauge is way, way bigger than a 24-gauge. All right, we've picked out our line. Now for the hands-on skill, the insertion. Let's walk through this step by step. Now the whole process is really systematic, and that's all about patient safety. You get everything ready, you pick and clean your site, and then you insert the needle at that shallow 15 to 30-degree angle. But step 4, that's the magic moment. You're looking for that little flashback of blood in the chamber. That's how you know, for sure, that you're in the vein. As soon as you see it, you advance the plastic catheter, pull the needle out, and get everything secured and documented. So getting the IV in is one thing, but what's just as critical, if not more so, is knowing when something's gone wrong. A patient's safety really depends on you being able to spot complications, and spot them quickly. Complications pretty much fall into two buckets. You've got local complications, which, just like the name says, are problems right there at the insertion site. Then you have systemic complications, which are way more serious because they affect the whole body. We're going to focus on the two most common local issues you're likely to see. So, first up is something called infiltration. This is what happens when the little catheter accidentally slips out of the vein. The fluid has to go somewhere, right? So it starts seeping into the tissue around it. The key things you're going to see are swelling, some pain, and skin that feels cool to the touch. That's because of the room temperature IV fluid. Phlebitis, on the other hand, is totally different. This is when the vein itself gets inflamed. It could be from the catheter rubbing against it, or maybe from the medication itself being irritating. So instead of cool and swollen, you need to think of the classic signs of inflammation. The area is going to be red, warm, and you might even feel a hard, rope-like vein. Okay, so the line is in, and we know what to watch out for, but hey, the job's not over yet. Let's talk about the final phase, keeping things running smoothly and taking the line out safely. Think of this as your professional checklist. You're going to be checking that site at least once a shift, and you'll rotate the site every 3 to 4 days to help prevent any issues. And, of course, keeping everything sterile, making sure the flow rate is right, and documenting everything you do, those are absolutely non-negotiable for keeping your patients safe. Finally, when the IV isn't needed anymore, taking it out is pretty straightforward, but you gotta do it right. You'll stop the infusion, take off the dressing, and then pull the cannula out smoothly. The most important step here is to immediately apply firm pressure with some sterile gauze. That's the key to preventing any bleeding or a nasty bruise, which we call a hematoma. So, we've walked through the what, the why, and the how of IV therapy. But knowing the information is one thing, applying it is another. So let's end with this. You walk into a patient's room and you see their IV site is swollen, cool to the touch, and they say it hurts. You're thinking, infiltration. What is your very first move? Have a think about it.